On page 3 of the calendar appears Senate Bill 1169. Leader Gable. Read the bill, Mr. Clerk.
Senate Bill 1169, a bill for an act concerning safety. The bill is read for a second time previously. Amendment number 1 was adopted in committee. Floor amendments 2 and 3 have been approved for consideration. Floor amendment number 2 is offered by Representative Gable.
Representative Gable on floor amendment number 2.
Thank you, Mr. Speaker. I do not want to adopt Amendment 2. I want to adopt Amendment 3.
Mr. Clerk, please withdraw floor amendment number 2. Further amendments.
Floor amendment number 3 is offered by Representative Gable.
Leader Gable.
I'd like to adopt this amendment and speak on the amendment on third.
Seeing no one seeking recognition, the question is, shall floor amendment number 3? Apologize. Representative Mazzocchi on floor amendment number 3.
Thank you, Mr. Speaker. Will the sponsor yield?
She indicates she'll yield.
Leader Gable, it's my understanding that floor amendment 3, that no individuals were able to file witness slips in connection with that. Do you know why that is?
It went straight to the floor.
Okay, so just to be clear, so when it comes to the over 50,000 witness slips that were filed for floor amendment 2, because the Rules Committee sent this floor amendment number 3 straight to the floor, that's the reason why nobody was able to file a witness slip either in favor or in opposition of your floor amendment number 3. Is that correct?
Apparently.
All right. Thank you, Mr. Speaker. I vote on this amendment because it has clearly not been properly vetted by people who have an interest in the outcome.
This amendment is very similar to Amendment 2.
Oh, no.
It was just a technical change.
No, it's not.
Leader Batnick, was that a request for a roll call vote or? Okay. The question is, shall floor amendment number 3 be adopted? All in favor vote aye, all opposed vote nay. The voting is open. Have all voted a wish? Mr. Clerk?
Representative Hallbrook.
No.
Representative Hallbrook votes no. Representative Morrison.
No.
Representative Morrison votes no.
On this question, there are 63 voting yes, 48 voting no, and 2 voting present. Floor amendment number 3 to Senate Bill 1169 shall be adopted. Third reading. Read the bill, Mr. Clerk.
Senate Bill 1169, a bill for an act concerning safety. Third reading of the Senate bill.
On this debate, there will be a 3-minute time limit. Individuals will be able to give time to other individuals. Leader Gable on Senate Bill 1169.
Thank you again, Mr. Speaker. Senate Bill 1169, House Floor Amendment 3, is a clarification of existing law. As everyone knows, the Healthcare Right of Conscience Act was created in 1977 to ensure that healthcare providers and pharmacists are not required to perform or provide medical treatment, specifically abortion care, against their conscience. While the language of the act is poorly drafted, the legislative intent is not a secret. We have over 40 years of legislative intent to rely on, established on the record on the floor of the House and the Senate by both Democrats and Republicans. We know with certainty that this act exists to preserve the ability of healthcare providers, including pharmacists, to refuse to perform or provide health services related to abortion and reproductive health care that violate their conscience. In 1977, the House debate made clear that the HCRCA is about abortion and refusing to give advice or counsel concerning the use of contraceptives or any method stopping children from being born, birth control. That's House debate, page 494. Senate debate in 1977 made clear that the Health Care Right of Conscience Act expands previous efforts to include other medical procedures, such as sterilization or advice on family planning. Page 377, line 22 to 27. We also know with certainty that the act is being intentionally distorted by those who favor misinformation over fact, and those who are using this act to justify their desire to thumb their noses at the mitigation efforts imposed by employers to stop the spread of COVID-19, a deadly virus that has claimed the lives of over 25,682 Illinoisans as of noon yesterday, along with 700,000 people in this country and 5 million across the world. According to the Attorney General, clarifying the statute will help to ensure that the original legislative intent is preserved. Contrary to rampant misinformation campaigns, this bill is not a vaccine mandate. In fact, it does not require anyone to do anything. As the bill itself says, this is simply a declaration of existing law and shall not be construed as a new enactment. In addition, the bill enshrines all federal protections available to anyone, including any civil rights or religious protections. The final sentence of the act states that, quote, nothing in this section is intended to affect any right or remedy under federal law, end quote. The bill before us today simply clarifies the well-established legislative intent of the Health Care Right of Conscience Act. That is all. Anyone who claims otherwise is engaging in the spread of misinformation, and I ask for your aye vote.
For discussion, Representative Nieberg, 3 minutes.
Thank you very much, Mr. Speaker. Will the sponsor yield?
She indicates she'll yield.
I just have a few quick questions. What recourse does an individual have if they do not wish to take the COVID vaccine, if this is amended as you so deem fit?
Well, contrary to rampant misinformation, this bill is not a vaccine mandate. In fact, it does not require anyone to do anything, and the bill says that they have access to what the federal laws that are in place now.
So you're saying they have federal law. So if I decide that I don't want to get the COVID-19 vaccination, if this is passed, I can go to the federal law and take that up for what? For a release, a disclosure? How does that process work?
You can still request an exemption under a Medical Help Disability Act or Religious Act for Exemption.
And what's the time frame on something of that nature with the federal government in order to receive that exemption?
No, actually, it's a form that you fill out and you give to your employer, and the employer decides.
And what if they don't accept it and they point to the modifications of the Health Care Right to Conscience Act as you want to pass them?
The Right of Conscience Act has nothing to do with the federal law of religious exemption.
So we're here in the state of Illinois talking about the state of Illinois, talking about religious exemptions. I don't know how the process would be for the federal level. I look at the healthcare right of conscience for everybody in the state of Illinois, and they're able to say, here it is. This gives me the exemption. Why would I need to go to the federal level? I don't understand that.
Well, you
And I
don't-
think we'd have a better chance of getting struck by lightning in a decent time frame than to hear back from the federal government whenever we have an exemption right here in front of us.
Well, you're not going to the federal government. You're using the federal law. And in the state, we oftentimes use the federal law.
But still, we're here in the state of Illinois. We're in Illinois, and we're talking about religious exemptions in the state of Illinois. But I'll go to the second question. If this is passed as you want it to be, can a school mandate vaccinations for school-age children as amended? Will a school be able to do that? Just mandate vaccinations for children?
This law doesn't affect that one way or the other.
Well, I think it does, because as your amendment reads, it's a violation related to COVID-19 requirements. It reads, line 8, 9, and 10. It is not a violation of this act for any person or public official to institute any mitigations they seem fit. I'll go to the bill. Ladies and gentlemen, this is absolutely atrocious. This is unbelievable that we're considering this on the House floor. This is not about the healthcare right of conscience. This is about the last 18 months of unilateral authority from the governor. Now he's asking us to remove the only opposition. The Inspector General discussed, or the Attorney General discussed, the temporary restraining orders that are ongoing, everything going in the courts. They want to remove this so they can force vaccination on us. I ask for a no vote. Thank you.
Representative Morgan for 3 minutes.
Thank you, Mr. Speaker. To the bill.
To the bill.
Mr. Speaker, I stand in support of this very simple and straightforward bill today. I know there are some of my colleagues on the other side of the aisle who are angry. And I get it. I share their anger. I'm angry that COVID still exists. I'm angry that science has been politicized and substituted by misinformation and fear. I'm angry about that. I'm angry that people's discomfort and inconvenience with masking and taking COVID tests for purposes of contact tracing, their inconvenience and discomfort is threatening to outweigh the safety of my family and my community. The entire legislature, this entire body knows, and there's no dispute, none, that this law was enacted to protect healthcare professionals who do not want to perform abortions or administer contraceptives. There's no dispute. That is the purpose of this law. This entire body knows that. That's it. And not one bit of that changes here. Not one bit. But this law is being bastardized by a few rural courts, jeopardizing our efforts to protect the state of Illinois during an unprecedented, once-in-a-century pandemic that's threatening our health and safety. It would be laughable if it were not so real. Well, the majority will not stand idly by while that happens. This bill is very simple. Regardless of what you might hear, it's very simple. It closes a loophole in a totally unrelated law that is being exploited to try and end COVID mitigations, COVID masking in schools, and end COVID workplace testing. So vote yes on this bill. Vote yes to continue protecting our most vulnerable from COVID-19. Vote yes for this bill. Thank you.
Further discussion, Representative Ugasti.
Thank you. I'd ask first for a verification of the vote at the end, please.
Representative Ugasti has requested a verification.
Thank you. Will the sponsor yield?
She indicates she'll yield.
Leader, what is the effective date of the bill as amended?
There's no stated effective date.
I'm sorry?
There is no stated effective date.
So the bill that you're running tonight has no effective date, so it would be effective upon signing immediately?
No, it would be effective June 1.
Okay. So there's no stated date, but it does have an effective date. It's June 1 of 2022?
Correct.
Okay, so what we're voting on then tonight won't impact anyone concerning this act until June 1, 2022, correct?
I believe it will clarify the intent of the legislature.
To the bill. You know, it's interesting. We're talking about the intent of the legislation and what it was truly meant to say. And yet I don't recall COVID-19 being around or being mentioned back in the 1970s when this was passed. But either way, this is about religious exemptions. You know, Article 1 of the United States Constitution, the Bill of Rights, or the First Amendment, I'm sorry, not Article 1, but the First Amendment of the U.S. Constitution says Congress shall make no law respecting an establishment of religion or prohibiting the free exercise thereof. It's one of the bases for the founding of the nation. It's the very first provision in the Bill of Rights. Yet tonight, after 19 months from the start of the pandemic, we're going to address for 7 or 9 months in the future when we may or may not still be having a problem, when maybe everyone's been vaccinated who can medically be vaccinated, we won't know. We're going to address whether or not someone should be able to exercise their religious beliefs that was so important to the founding fathers of our country that they put it in the first provision of the Bill of Rights. You know, it's amazing what we've seen since this pandemic has started. In this state alone, not to mention the nation, we've had increases in suicides, we've had increases in domestic abuse cases, we've had increases in opioid overdoses, we've had our children struggling to learn in schools, and we've had a mental health crisis appear, probably to an extent previously unknown. But not once did we as a legislature come in and do anything to address those issues. We sat back as they unfolded, and we let them unfold without addressing how the state had dealt with the COVID crisis may have affected these very issues. But there was a way. I've had a bill on file, but we didn't talk about it. But now, 19 months later, we are going to attack those who are holding their religious beliefs close to them. You may not believe they're telling the truth about it. The governor may not, the employer may not, whoever it is that's pushing this bill so hard may not believe that they hold those beliefs that dear. But you don't know that. You don't know what's in their hearts. They aren't telling you what's in your heart. Why are we as a legislature going to take that right away from them? To the prior speakers,
Representative Representative Grant would give you additional time.
Be done in a minute. To the prior speaker's statement about keeping people safe. Just because someone holds a religious belief dear doesn't mean they don't want others to be safe. I'd say probably much to the contrary. And as someone who's lost family members in part as a result of the disease we're here addressing, I can tell you that they, I know, would want to make certain that we're upholding and allowing people to maintain their religious beliefs because they cherish the freedoms that this nation had. They were immigrants to this nation and became citizens. And now we're looking to strip people of that right that they all held so dear. I ask to vote no.
Further discussion, Representative Zaki.
Thank you, Mr. Speaker. May I remove my mask?
Yes, you may.
All right. Thank you. Will the sponsor yield?
In case you'll yield.
All right. Leader Gable, because courts may not be familiar with our rules, do you dispute that for Amendment 2, which you said was the technical predecessor to Amendment 3, there were over 53,280 people who filed witness slips in opposition to your bill?
I don't dispute that.
All right. Now, Leader Gable, one of the reasons you stated Illinois needs this legislation was to clarify existing law because people are using the Healthcare Right of Conscience Act in a way that wasn't intended. But you do realize that with all of the various amendment switches you've done here, you're actually muddying the legislative intent that will be applied to your legislation. Do you realize that?
I don't agree.
Well, do you know how courts use the amendment process when it comes to deciding what is in or what is not within a bill for purposes of legislative intent?
The amendment is clear and it clarifies.
Not against the background of Amendment 2, but we'll get to that. Now, you've said that the administration has indicated this bill was needed to clarify legislative intent. But are you aware that the approach litigants have been taking in court recently is the same interpretation and meaning for this legislation that has been in place for well over a decade when it comes to this act?
The courts are still deciding these lawsuits.
No, ma'am. In fact, if you're, well, let's try to get it this way. Are you changing the law, or are you just changing with this bill what you believe to be the legislative intent?
I'm clarifying the legislative intent.
And that's it.
Yes.
All right, so when a court sees this legislation, the court gets to stick with all of the rights that a person had before this bill. They're just going to know what they think the legislative intent was.
This doesn't affect any of their other rights under any other laws, particularly under federal laws.
No, I'm saying about this Illinois Rights of Conscience Act. So all we're doing is we're saying, hey, courts, here's a legislative intent you may want to take a look at if you care about legislative intent when you're applying this statute.
We're clarifying that this bill originally was passed to impact the health relationship between healthcare workers and patients.
All right, well, you know what? That's irrelevant because are you aware that in 2007, the federal courts...
Representative Stevens would give 3 minutes.
The federal courts specifically reviewed our Healthcare Right of Conscience Act in Vandersand v. Walmart Stores, Inc., 525 F sub 2nd 1052, Central District, Illinois, 2007, and concluded that the courts of Illinois do not need to resort to aids for construction of this act, such as legislative history, when the language of a statute is clear. Were you aware of that?
This law is being used in a way it was not intended, and we are just correcting
I'm asking if you're aware of that court case, Leader Gable.
I am not aware of that.
All right, well, are you aware that in that same case, the court held that the language in our Healthcare Right of Conscience Act was abundantly clear, and, quote, that health care includes any phase of patient care, and specifically includes medication. The court has no need to resort to legislative history to understand the plain meaning of this text, and, quote, the court does not need to resort to legislative history to understand that the statute protects any person and that the plaintiff had stated a separate claim under state law, separate and apart from the Illinois Religious Freedom Restoration Act, as well as federal law claims. Were you aware of that?
Well, I've been informed that that court case was about reproductive rights in a healthcare setting. And
Well, that's not how the federal court interpreted it. The federal court, so was that misinformation by the federal court back in 2007?
No.
When the federal court wrote what I just quoted? Was it a bastardization of the law?
no.
Okay. Let's talk about an Illinois Appellate Court 4th District decision right here in Sangamon County. Morfitz, Inc. versus Quinn. The court there explained that our Conscience Act was designed to bolster a person's exercise of their rights by, quote, offering protections to those who seek not to act in the healthcare setting. The court noted that this right not to act was a different kind of right the right to refrain from acting, as compared to instances where people want to act, such as when engaging affirmatively in religious activity under the Illinois Religious Freedom Act. Now, there again, Governor Quinn, much like Governor Pritzker today, argued that the statute was ambiguous, asked the court to examine the legislative history to resolve that ambiguity. And the court again said no, because, quote, the statutory language itself, given its plain and ordinary meaning, is the best indication of legislative intent. And the court reiterated that when the statutory language is clear,
Representative, please. Representative Severns will give you his 3 minutes, and
the court
members, please keep the volume to a minimum. It's difficult for individuals to hear. Please proceed.
The court reiterated that when the statutory language is clear, we will give it effect without resorting to other aids of construction. Do you know what that means, Leader Gable?
Yes.
All right. Do you know what the court said that means?
Tell me.
The court said that means the plain and ordinary meaning of our Right of Conscience Act is that you cannot discriminate against anyone, quote, because of such person's conscientious refusal to receive, obtain, accept, perform, assist, counsel, suggest, recommend, refer, or participate in any way in any particular form of healthcare services contrary to his or her conscience.
So that case again was in a healthcare setting.
You don't think COVID is in a healthcare setting? Well, Leader Gable, here's the question. If that is settled law, why do you think this law requires clarification of the legislative intent?
Because it's being used outside of a healthcare setting.
It's not. In fact, the Moore-Fitz versus Quinn decision continues, and again, I'll quote it, I'll leave out the citations. The Conscience Act instead states that personnel or entities may not be discriminated against or punished civilly or criminally if they make a conscience-based decision not to comply. And the court continued that the governor could not enforce his administrative rules against the plaintiff. So let's turn to your amendments and how and why they're taking away rights and making the legislative intent less, not more clear. Now, one thing you want to have happen with this bill is that you will want a court to look at this legislative history now in 2021 when interpreting the Illinois right of conscience, right?
Yes.
All right, but the courts have already said they think our existing statutory language is crystal clear, and they don't need to go behind the statute and look at any further legislative intent. True? That's what the prior court decisions have said.
It's being appealed.
No, I'm talking about prior court decisions. They're done. The two that I just mentioned, those are done.
Oh, those were in healthcare settings. They didn't apply in this kind of a situation at all. Those were long before.
That's actually not true if you look at the crystal clear language of the statute, which already applies to private sector actors, employers, and private settings, not necessarily a healthcare employer. But let's assume that the court is going to actually look at the legislative intent for your bill, SB 1169. You agree that SB 1169 was originally a bill about making it easier for kids with IEPs to get access to career and technical education, right?
Representative McLaughlin gives the representative 3 minutes.
Do you know? You don't know. All right, well, that's what it said. So that had nothing to do with the Healthcare Right of Conscience Act. Now, House Amendment 1 to SB 1169 also had nothing to do with the Healthcare Right of Conscience Act either, right? It was just a shell?
Yes.
All right. So the first time we actually saw any substance for the Healthcare Right of Conscience Act was with Amendment number 2. And now you've got Amendment number 3. Let's talk about some of the differences in the language between Amendment 3 and Amendment 2 to SB 1169. One of the first changes you made between Amendments 2 and 3 is at Amendment 3, page 2, lines 1 to 2. Do you have that?
Yes.
All right. Now, the original language in Amendment 2 in a comparable position read, "It is not a violation of this act to enforce such measures or requirements, including by terminating employment or excluding individuals from a school, a place of employment, or public or private premises in response to noncompliance." True?
Yes.
All right, now in Amendment 3, you keep the language, "It is not a violation of this act to enforce such measures or requirements." Yes?
Yes.
All right, but what you did do was eliminate the language of including by terminating employment or excluding individuals from a school, a place of employment, or public or private premises in response to noncompliance, right?
Yes.
What was your intent when you took out the example of terminating employment?
We listened to the feedback in committee and we wanted to respond to that.
And explain that further. What feedback? So now, are you saying that nobody can have their employment terminated in connection with any refusal in connection with any COVID-19 related issues?
No, they can be terminated now. Like, federal law still applies.
Federal law still applies.
Right, under state law.
This law does not let any
Do you know?
facility to terminate anybody.
Or is your staff member just trying to tell you?
Yeah.
Maybe you should let her have the microphone.
This law does not determine if someone can be terminated or not.
All right, well, your original amendment, too, though, was being pretty transparent that your bill would let an employer fire someone for not doing whatever that employer wanted with regard to COVID-19, right?
They can do that now.
Okay, so even with your Amendment 3, you think an employer can still fire someone for not doing whatever that employer wants in regards to COVID-19, right?
Even if this law never existed, employers already can and already do set their own employee protocols regarding workplace safety.
Right, and before
including measures intended to stop the spread of COVID-19.
Right, and before your legislation, if an employer did that and an employee thought you were going too far, or the employer was going too far, they could sue using this act, the Right of Conscience Act, right?
Representative, this will be the final 3 minutes that will be allotted to you.
You can't make that decision.
I just
Speaker.
did.
object to that.
Representative, the final 3 minutes.
It's
Please
abusive.
please bring your marks to close.
Do you know the answer to that?
So that's true regardless.
All right, and when it comes to schools, you're also not being as transparent. Are you aware that a court can now say that because you took those provisions out from Amendment 2 to Amendment 3, then based on the feedback you said you got at committee, that those things are actually off the table? That in fact, people can still continue to use this law to object to those things by saying those are still rights of conscience. You thought you were going to keep them in, now you're taking them out.
Well, I disagree. All federal laws still apply.
No, you don't understand how state laws are going to get applied and how the courts actually use legislative intent. Well, let me go to the bill since the speaker is prematurely cutting me off.
To the bill.
I met a very nice lady at a pancake breakfast in my district. And when she and I talked, I asked her, "Are you vaccinated?" She said, "Yes." I said, "Do you think other people should get vaccinated?" She said, "Yes." I asked her, "But do you think kids shouldn't be allowed to go to school unless they get vaccinated?" And her answer was, "Oh, no." I asked her, "Do you think government should be forcing people to get vaccinated if they refuse, or if it violates their right of conscience, or that their employer should be forcing that?" And she said, "No." She intuitively understood what over 53,000 people and counting who filled out witness slips against this bill are trying to tell the governor and this legislative body. Government is supposed to persuade, not force. Government is supposed to respect and protect our civil liberties, not disregard them. And that is because we are citizens, not subjects. If we're going to say that there are healthcare services that are so important that we need to mandate them, spit it out, say it plainly, and enact it into law using the regular legislative process. And then every single one of us can be accountable to the people back in our districts for the vote that we took. What we don't do is destroy the separation of powers. Let an executive order or even an executive threat become the equivalent of the legislative process. And then take away the very remedy that the little guy, the powerless, the poor, the people have against government, administrative, and corporate overreach when it comes to medical rights of conscience. Let's also be clear that in this state, this is an unprecedented effort to backdoor a vaccination mandate without any lines of accountability, including at the legislature, and without any escape valve for religious liberty. Every other vaccine mandate we have in the state of Illinois is specific, limited, was passed by the legislature after years of conclusive scientific proof of beneficial outcomes, and they all still allow for religious exemption or independent proof of immunity to satisfy the statute. You haven't even offered a reasonableness or scientific efficacy standard for what you're doing here. If you were being scientific, you'd be testing everyone in, for example, congregant care facilities. Because according to the September 16th, 2021 New England Journal of Medicine, vaccinated healthcare workers with breakthrough infections, even though they may have had mild symptoms, they had high viral loads and had prolonged viral shedding for up to 32 days after diagnosis. But the governor is not saying that even in his state facilities, he's not making those people test. So much for following the science. This legislation is designed to lead to absurd results where you can let an employer or any person employed by any unit of government in the state of Illinois force a person to do things, even things your doctor thinks is medically contraindicated, wrong, or harmful. And tonight, your yes vote means you've denied them a remedial claim. They get nothing in a court of law. That is contrary to the legislative intent of our Right of Conscience Act. I urge a no vote.
Members, once again, an announcement. This is a reminder of House Rule 51.5. Please remember to wear a face covering that covers the nose and mouth, except for when necessary for eating or drinking. Members may remove their face covering when speaking on the microphone at their desk. Again, please remember to wear a face covering as pursuant to House Rule 51.5. Representative Davidsmeyer.
Thank you, Mr. Speaker Hoffman. Will the sponsor yield?
Indicate she'll yield.
All right. We had a very long question and answer in committee. I'm going to run through a few of these, and I'm going to hope to get through them fairly quickly. So you're saying, are you trying to clarify the law, or are you actually changing the law to add COVID?
First, let me respond to the last speaker. I just want
No. This is my time. I asked you a question, please.
That this bill is not a vaccine mandate.
It just gives a mandate. So I'm going to go to the bill because obviously I'm not going to get to get these questions answered. So this specifically uses the term COVID because it's trying to scare people into thinking that without this, we can't encourage vaccines. They're saying that this could require the flu shot. It could require HPV. It could require hepatitis vaccine. It could require the AIDS vaccine because they're saying this does not apply to the individual decision. This only applies to a doctor making the decision for you or a pharmacist making the decision for you. And I hope people on that side are listening a little bit. I understand you probably already made up your decisions, but think about this. We're talking about individual decisions, okay? So I kind of want to go back to clarify that this is not a clarification of the law, because back when this law originally went through, Phil Rock in the Senate said that an individual can refuse treatment, and this act does not take this away. So I want you to go back and review that, because Phil Rock specifically said that this does not take away that individual decision. In committee, the governor's people focused on a business liability. They weren't worried about the individual decision, the individual freedom. They were worried about a liability of a business if they force their employees to do this and something bad happens. They were more worried about the business or the state of Illinois, for instance, than they were about the individual decision to make an individual health care choice. Now, individuals have to be allowed to make their own health care decisions. They have to be given this opportunity. We have a vaccine that I probably need a little more time, so.
Yes, Representative Kiker gives you 3 minutes.
Thank you, Representative Kiker. You're the best. So, individual decision. We have a vaccine that has been on the market for what? Maybe a year? It was approved under emergency decision by the FDA under political pressure. And then the Pfizer, which, you know, there's an argument whether that was actually approved or if it was a new vaccine. So in America, is the Pfizer vaccine even approved by the FDA? I don't believe it is. I think it's the Commissar or whatever it is vaccine. So we are going to force somebody to take a vaccine that hasn't been around very long. And let me clarify this for everybody. And I know not a lot of people are listening, but I'm going to get pretty loud because nobody's listening. I want you to know that people have come into my office and said they get the flu shot every year. They get the flu shot every year. But they are concerned about this vaccine because it hasn't been around for very long. Right? We are going to force people to make a decision between their livelihood, between taking care of their families, and taking care of their individual health. This is absolutely insane. These are not anti-vaxxers. Now, are there some people out there that are anti-vaxxers? Certainly there are. But there are individuals who have come into my office who have said, I get the flu shot every single year. And you said they're stupid, right? They're stupid to be worried about their own health care because they don't trust their government. Right? Government has made a lot of horrible decisions. Look in the history of the United States. Have they ever forced people to take vaccines? Have they? Anybody? Yes, they have. Have they had adverse results on those individuals? Yes, they have. You're forcing people to take a vaccine that they don't want to be forced to take. And I have gone to the governor's people and I've specifically said, look, I will encourage my constituents to get this vaccine, but they have to be able to do it on their own timeline. But your mandate is making them dig in their heels and say no. They have to be able to make this decision without being threatened, right? Without being threatened with their livelihood. So please think about individual decisions. I know you're worried about fear and all these things, but if you have the vaccine, you should be protected. We have to think about other people and their decisions. I know you want to force other people to do this, but I think they will. I think they will come along, and I think they will realize that the vaccine is safe, but they have to be allowed to do it in their own time. So please, please, please allow these individuals to make this decision. And it shouldn't be the government's decision first off. It should be an individual decision on what they do for their individual health care. With that, I want to encourage a no vote, to vote for individual freedom, not for government mandates. Thank you.
Further discussion, Representative Hammond.
Thank you, Mr. Speaker. To the bill.
The bill.
I firmly believe that the COVID-19 virus is real. It is absolutely real. I personally am also convinced of the source of this virus, but my opinion on that is not important in this discussion. I also believe that this vaccine did not appear overnight. In fact, I know for a fact, having spoken with Dr. Peter Hotez from Texas Christian, that this vaccine has been in the works since the SARS outbreak of 2003. And the reason for that is because when SARS outbreak appeared in 2003, many people were firmly convinced that the source of this outbreak would continue with other outbreaks, and in fact, they were right, because now we have COVID-19. In a year, or 2, or 10, we may have something else. And I pray that those same scientists that have been working on this since 2003 are working on another vaccine that will help us in the future. For myself, personally, I am fully vaccinated. I will also get a booster shot when it's appropriate time. But that is my choice. I have made that decision. Many of my constituents do not share my belief, and I respect them for that. We talk about misinformation. This is not misinformation. Let's give people credit for having individual rights and deciding what they think is right for their body. This is not how this act was intended. Please vote no.
Representative McCombie.
Thank you, Speaker. Will the sponsor yield for a couple questions, please?
In case you yield.
Thank you. Representative, is the point of your bill to protect the people of Illinois?
Yes.
For clarification, again, I think Representative Ugasti mentioned it. The effective date is June 1st of 2022. Is that correct?
Correct.
How many votes is required of passage of this bill with that effective date?
It's a parliamentarian question.
You don't know how many votes you need this evening?
I believe it's 60.
Yes, thank you. How many votes would be required for the passage of this bill if it was effective immediately?
71.
Thank you. Speaker, to the bill.
To the bill.
If this bill was truly about protecting the people of Illinois, we would be having an effective date immediately. We would not be waiting 7 months, 216 days from today, if this was really about protecting the people of Illinois. Vote no.
Further discussion, Leader Wheeler.
Thank you, Mr. Speaker. Will the sponsor yield?
Shinikesha yield.
Leader Gable, you and I had a discussion in committee yesterday, and I had asked you questions based on what one of the witnesses, Mr. Gilligan, had brought forth about the broadness of the language in this bill. I want to just point out to you again that this message, or what's in the bill specifically, refers to literally any person or public official for any public or private association, agency, corporation, entity, institution, or employer to take any measures or impose any requirements, including but not limited to any measures or requirements that involve the provision of services by a physician or healthcare personnel, again, not limited to that, intended to prevent the contraction or transmission of COVID-19. Why is this written so broadly?
It mirrors the language in the Healthcare Right of Conscience Act.
Okay. Well, where in the Healthcare Right of Conscience does it give us any definitions about the prevention of contraction the contraction or transmission of COVID-19?
No, but the beginning part
It
does.
speaks for itself. It doesn't need a definition.
That's in the beginning part of the Healthcare Right of Conscience Act?
It doesn't need a definition. It speaks for itself.
I'm sorry, I can't understand what you're saying because you have a mask on.
It speaks for itself. It doesn't need a definition.
Wow, that's amazing because I know doctors that disagree about how we could
Mitigation
approach,
of COVID-19, they disagree?
about how it could be contracted, how we could prevent transmission.
Really?
I'm not a misinformation person, I know you know that. But I have had discussions with people that disagree, that are reasonable people, about what we could or should do. Other countries disagree with our approach, other states disagree with our approach. We aren't absolutely
The medical community
perfect.
is pretty clear about what we can do.
I wish I could understand you more clearly.
I think the medical community is very clear about what we can do for mitigation.
Well, I guess that could lead to the next part of my question. Since we're not putting any thresholds in here, anyone can interpret it any way they want to, because we're not asking for medical personnel to be involved. Anyone can be making these decisions.
We are in no way impacting the healthcare patient relationship with COVID. We are just trying to say, never mind, just reiterate what we know.
I'm not clear about your question.
Okay, well, again, you put a not limited to clause in here, so everything that I said means that anyone can interpret this any which way that they so choose and not be subject to healthcare right of conscience with respect to a definition that they choose of COVID-19 transmission or contraction in any way that could be prevented by intention. I mean, this is really broad.
I disagree. I don't think it's very broad at all. It's very specific.
Leader, Representative Luft will give 3 minutes.
Appreciate that. Thank you. Leader Gable, we're going to move on because we had this discussion yesterday and it's about the same as it is right now. I wanted to talk to you about, you said that many times, both yesterday and today, that if someone has an objection to the vaccine for whatever reason, they can still use the federal law that applies. Correct?
If their employer is requiring it, yes. This is not a mandate to anyone. Employers,
It's a restriction of a right.
no.
Okay.
It's clarifying the intent of the Healthcare Right of Conscience Act.
Okay. Which also includes the patient, not just the provider. And we're talking about the patient in this case. The patient's choosing, for a reason of their own conscience, not to participate in a vaccine. Correct?
It
That's what
clarifies when this
the
act can be
50,000 plus people who responded via witness slips yesterday, that's their impression. That's their
That's
feeling
their
about this.
impression, correct, but
Not yours.
they're misrepresenting this law.
Wow, man, I beg to differ. I really do. I guess my question was going to be, if federal law still applies, then what's the absolute need for this? Why is this so important?
Because it's being improperly misused.
So, because they have a conscience?
No, because it's being applied in the context of employers and employees. And this law, the intent of this law was to be used in the healthcare setting between
Is a
providers
vaccine not a
and
form of
patients.
health care?
It can be in the, but that, no, it's a, what was the question? Is it a healthcare? Please restate your question.
Is a vaccine not a form of health care?
Yes, but employer and employees are not.
Employees are not subject to health care? They don't get health care? What are you
They
saying?
not, the bill, as I've stated a number of times, the healthcare right of conscience was established to protect healthcare providers who do not want to provide abortion or other reproductive care
That's
services.
okay. Is there a section in the Healthcare Right of Conscience Act that says that patients have a right to object to treatment?
I don't think so. I don't think so. It's not. It's for the healthcare provider, not the patient. The patient is trying to get a service that the healthcare provider does not want to provide.
I think that this is absolutely incorrect.
I disagree.
Well, I'm going to read it to you here in a minute once we find it. So, to be crystal clear, you don't believe there's any part of the Healthcare Right of Conscience Act that protects the patient. It is only meant to protect a healthcare provider.
Representative Meyer, would you be willing to give us 3 minutes?
That's not what I said.
Okay, then please restate what you said, because that's how you answered the question I asked.
The intention of this bill was to clarify that the Healthcare Right of Conscience Act was to apply to healthcare providers and allow them not to provide abortion or reproductive rights care if they don't want to.
So when I read this, where is it again here? It is the public policy of the state of Illinois to respect and protect the right of conscience of all persons who refuse to obtain, receive, or accept, or all engaged in the delivery of arrangement for and payment of healthcare services. I believe that talks about a patient. They're refusing to obtain, receive, or accept treatment.
Well, I believe people are using this as a loophole to get out of protections that their providers, that their employers are requiring.
Let's repeat the point here. Protect the right of conscience of all persons who refuse to obtain, receive, or accept. That's a patient issue. That's in the current act.
In relationship to reproductive health.
Really, what part of it is in there? Because I'm looking at 745 ILCS 770/2, blah, 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 paragraph 5302. If you can point out to me where it says that in here, I'd be grateful. I don't see it.
He's trying to say that the original intent was to apply in this setting. Your point of the amendment is to say it doesn't.
I believe that the original intent of the bill was not to apply in this type of setting.
Well, I have some incredible news here. What we write in the bill matters. Not what we say on the floor. That helps, but this is pretty clear. This is actually very clear that people expect a right. They have a right now. They have a right. And this bill effectively changes that right when it comes to COVID-19. So I'm going to move on here to the last thing I wanted to say. I asked you this yesterday, and I got no response, so I'm going to ask it again. A young woman in my district went to her employer, who is part of our government. She's a public servant. She's a young woman with a great future in front of her, beginning her career. She wants certainty about what she can expect from her job. We're telling her that she has to get vaccinated. She talks to her doctor. Her doctor says, well, I can't absolutely guarantee you there'll be no long-term side effects from the vaccine, so she has a conscience issue. She wants to start a family. She wants to do other things in life, things that we can't absolutely guarantee. I wish we could. So we are giving her effectively a choice because we're taking this right, in effect, away. Her choice is she continue her employment and she can feed herself and her family, or she has to take this vaccine. What am I supposed to tell her?
We're not taking anyone's rights away. This is between her and her employer.
You've got to read the whole act. The act has a right in it. I read it to you twice. It's a right, and you're negating that right with this amendment to this act. So clearly, you don't have an answer for her question. Her question's valid. She's a public servant. She's not spreading misinformation. She's not an anti-vaxxer. She has a real concern. Her conscience is heavy. I want to support her. I want to support her right.
If she has a religious objection, she can apply.
To the bill.
Ladies and gentlemen, our job here is to protect the public, to promote public safety, while we protect people's rights. This healthcare right of conscience is real. It exists today, and it protects patients. What we're doing today negates part of that. We're creating fear in our state unnecessarily. I want people to realize this has more unintended consequences based on how broadly this bill is drafted and what its intent is. And I have true concerns about the fact that this is a clarification of existing law, which means that they're going to say, we're going to pass it with 60 votes. It won't go into effect until June, but since it's a clarification, hey, you know what? That counts for right now. I have real concerns about this. Please vote no.
Further discussion, Leader Welter.
Mr. Speaker, to the bill.
To the bill.
We have continued to hear tonight from the sponsor, this is not about vaccine mandates. This is simply not true. We would not be here today discussing this bill in this manner if that was not the case. I've had COVID. I've been fully vaccinated. When our community was looking for vaccinations, I reached out to the governor's office, coordinated with him and his administration, and we launched one of the largest mass vaccination sites in our area, prioritizing educators and frontline workers and ensuring that our community was safe. But you know, at that time, the vaccine was optional for these workers. They weren't being forced or mandated, and we were encouraging them, and we're getting a lot of people out there. I've sat with frontline workers. You know, the people that we recently held in such high regard as heroes during the beginning of this pandemic, but now we're willing to take their livelihoods away from them? It just doesn't make sense to me. They're pleading with me to stand up for them, stand up for their individual medical decisions that they want to make for themselves and their families. Some of these people have used this law to save their livelihoods, to provide for their family. These are good, honest people trying to make a living while exercising the rights that they hold so dear under Illinois law. Mothers, fathers, husbands, wives, brothers, sisters, all people, you get my point. This bill strips the rights that may afford them under the existing law. Let individuals make their own health care decisions without the threat of losing their livelihood, folks. I strongly urge you to vote no.
Representative Swanson.
Thank you, Mr. Speaker. Will the sponsor yield?
She indicates she yield.
Thank you. Okay, I see you now.
Where is he?
So I've got a question, and a scenario that many of us probably have received phone calls from our constituents in our areas. And I'd like to know what responses I can give these constituents. And it's about their rights. We all most likely have reactions. We most likely have constituents in our districts that have reactions to vaccines, or they have an immune system that's deficient and they cannot have a vaccine. How can they request an exemption? By closing these so-called loopholes. Sometimes loopholes are good and protect some of these people, but what can I tell them?
Under the American with Disabilities Act, they can apply for a medical exemption.
So thank you for that answer, but let's talk about that. Let's talk about that teacher or that other employer who those rights are stripped away too. But
Their rights are not stripped away.
well, I don't know how many of you in your districts have had teachers and people quit their jobs because of the vaccine mandates, but several in my district have. And let's go back to my initial question. I just wanted to get that comment out there. So the American Disabilities Act will allow an exemption for those with an autoimmune deficiency. Is that what you're saying?
Yes, they can apply under that act.
Does an employer have to take that? Are they mandated to take that exemption?
Yes.
Okay, so we've got this on the record that I can show employers that I've been told that they can and should accept that.
Yes.
Okay. Anybody need 45 seconds? Thank you, Mr. Speaker.
Thank you, Representative. Representative Wright.
Thank you, Mr. Speaker. I'm going to go to the bill.
Do the bill.
Representative, you've said the of conscience of providers in cases of abortion. You said that, and you've admitted reading the statute that this patients, not just providers. The cases that have been decided using this law as justification for a finding for the plaintiffs are subject to appeal. Do you agree with, well, I can't ask you that, are subject to appeal. And if what you're saying is that the intent of this bill is plainly to protect the rights of conscience of those who provide abortion and contraceptive services, then these cases probably will be overturned on appeal based upon an examination of that very same legislative intent. So therefore, it undercuts the reason, that's one undercutting of the reason why we need this bill to begin with. You also stated that now we're down to 60 votes, so this bill cannot go into effect until July 1st of 2022. If that's the case, why are we doing this instead of having a fresh bill with its own bill number under the exemptions code that we can put in there that deals specifically with COVID that could be enacted as early as January if we come back here, put it through, ram it through the Senate, and get the governor to sign it? To me, that's a much more expedient way of handling what you consider to be the emergency that has to be done in this bill. But the biggest problem I see with this bill is the fact that it sticks a camel's nose under the tent flap. If the right of conscience is as precious to you as you have indicated that it is, that right of conscience is going to be protected throughout, regardless of whether COVID, and it's only because of COVID, what you're doing is you're sticking flap in the form of a precedent that somewhere down the road, another reason could pop up for us to go into the right of conscience and find a way to erode or prohibit or restrict it. There is not so much trying to protect the health of of the people of the state of Illinois as you are trying to further undercut the precious liberties that are bound up in the Right of Conscience Act. This is a special act. This is a special act. It's one that provides whose underpinning is specifically based upon the right of conscience through religious and other deeply held beliefs. I think you're running a very big danger here of creating a precedent that someday may be used to permanently erode those precious gifts that we have from our founders and from God. You are creating a danger to a bill that has a special place in our laws. You shouldn't be doing that. This bill can be rectified in January. If there's still a problem with it, we can vote on it in January and we can move on. This is a Trojan horse. This is a Trojan horse, and I strongly urge a no vote. Thank you.
Representative Calkins.
Thank you, Mr. Speaker. Will the sponsor yield?
She indicates she'll yield.
Representative, you claim that this is a loophole in the law. It's your interpretation, the governor's interpretation, that people are using a loophole in this law, the Right of Conscience Act.
That the act is being used incorrectly.
You've said it before, that there's a loophole. This is being used by individuals as a loophole, using a loophole in this law.
Yes, it's being used as a loophole. It's being used as a loophole.
Yes. So if there's a question about this, shouldn't this be settled in the courts? We have cases all over the state of Illinois challenging this law. Shouldn't the courts decide, is this a loophole? Is this the intent of the law? Or are you trying to circumvent these court cases, trying to protect the governor's position on mandating vaccines?
This will be settled in the courts. This is our attempt to make sure that the courts understand our intent.
It's your intent.
Our intent, the legislature.
Yeah, but it wasn't the intent of the people that drafted this bill.
Clearly
originally.
It was.
Well, we've read.
It's only been used. It's only ever been used around the issues of reproductive rights for healthcare providers and protection.
Maybe there's an unintended consequence back when they drafted and passed this bill. Maybe there was something in this bill that now we're faced with during this pandemic, that this unintended consequence is that individuals could use this right of conscience to not be mandated to take a vaccine. And shouldn't this be left to the courts to decide?
It will be decided by the courts.
No, you're trying to decide it here tonight.
No, we're trying.
You're trying to
clarify
force
the intent.
You're trying to force your version of what the intent of the original bill was.
We're clarifying the intent.
Were you here when they drafted and did the original bill?
No, I was not. You were not. None of us were, but...
Somebody was.
None of us were. But Mary, I don't know. I don't think Mary was there. But clearly it's been, the way that it's been implemented over the last 40 years, the intent is clear.
But this is an initiative of the governor. This is an initiative of the governor to respond to the uprising, as he calls it, to the charlatans or whatever, that people that don't want to take this vaccine, they have a health-related, I guess, belief that they shouldn't take this vaccine. The governor's not happy about it. He's not happy about being in court, and he wants...
Representative Calkins, Representative Freeze, would you give him 3 minutes? Representative Calkins, you are the second to last speaker, then Representative Batnick. Please proceed.
Thank you. Thank you very much. So isn't this a way to get around these court cases?
No, it's to clarify the intent.
But isn't that what the courts are going to do? It's to clarify the intent. The legal branch, the third branch of government that settles these disputes, why aren't we letting them do their job and let the chips fall where they may? If this is such an emergency, if this is not what this bill ever intended, why not let the courts settle this?
They're going to be clarifying the intent based on, they're going to be looking to us to see what we do as well.
So you're trying to influence the court's decision?
We're trying to clarify the intent of this act.
No, you're trying to pass a bill to influence the decision of the judicial branch. You weren't here, we weren't here. This bill was passed many, many years ago. And now, because of this, because of the court challenges and the interpretation of this bill by so many people in this state, you want to change or impose your side's interpretation, 60 of you tonight, or however many, to change the interpretation of what this bill is and circumvent the court.
No, we're basing it on the 40 years of experience we have with this law.
What? I'm sorry?
We're basing the clarification on the 40 years of experience we have had with the Health Care Right of Conscience Act.
Well, we haven't had COVID for 40 years.
Representative Calkins,
Yes.
would you mind going to the bill?
Yes, I do mind, but I will. To the bill.
To the bill.
This bill is an attempt by the administration to circumvent the courts. We have many, many cases all around this state of people who have taken their right of conscience to a court to decide their fate. This is an end run around the judicial branch. We shouldn't be doing it. This isn't going to help things. It's not going to make anyone any safer. And all it's going to do is make people dig in their heels and be more resistant to taking this vaccine. And I urge a no vote.
The final speaker, Leader Batnick.
Thank you, Mr. Speaker. Will the sponsor yield?
She indicates she'll yield.
Hey, Representative, I think I started the day when we took roll by saying today, October 27th, is actually National Cranky Coworker Day. I think some of us are getting cranky here, but I wanted to clarify a couple things you stated. I think you stated that the medical community is clear on these issues. Is that correct? Earlier?
On mitigations,
Yes.
pretty clear.
Okay. What does the CDC recommend on masking? I might know a little bit about masking, by the way. I get lots of emails on it. Some of them aren't too happy with me, but what does the CDC recommend on masking? Ages 2 and up, right?
Yes,
Okay, what does the World Health Organization recommend on masking?
I'm assuming the same.
No, they're not. It's 12 and up. Other countries, if you've had COVID, you get 1 shot. In our country, if you're 12, you get 2 shots. Other countries for kids, they're doing 1 shot.
I don't know which vaccines they're using in other countries.
Well, they're using Pfizer. They're using some of them. But the point is pretty clear. We can simply go back to the masks, that the medical community is anything but clear on this issue. Let me ask you another question.
In this country,
Do you think a 6-year-old is better served by getting COVID naturally when they're much less at risk at it, as opposed to getting a vaccine and not getting the full immunity for it that might affect them for the rest of their life? How do you feel on that?
I'm not a doctor.
You're right, and we're voting on this bill. I'm going to go to the bill. The medical community is anything but clear on this. This isn't about this bill. There were 50,000 witness slips filed because we haven't done our job for 20 months debating all these nuances. I talked about it in a press conference last week. My wife teaches a kindergartner that's forced to wear a mask that has autism, and it is not in the best interest for that child in that situation to be wearing that. But we have refused for nearly 2 years to do our jobs. Things aren't black and white, and people back home are hanging on to this bill. They're hanging on to this act because we're not acting. They can't come to us. You guys have to say the same thing. Well, you know, it's the governor's executive order. We're not debating it. That's what this is about. The people that are upset at school board meetings, the people that file the witness slips, the people that are going into places that I wouldn't go would be less upset if their legislators, the people whose office they can go into and talk to, were actually having very clear debates on these nuanced situations. But we want to do a one-size-fits-all, and this is the last hope they have. Let's not take that last hope that these people have, and let's vote no on this bill. Thank you.
Mr. Clerk, before we go to the closing of by the sponsor, is Mr. Tarver on the roll? Representative Tarver?
Is Representative Tarver present?
I'm present.
Representative Tarver is present. Representative Tarver, could you go on the video once more? And say you're present.
Representative Tarver, please say you're present. Representative Tarver is present. Leader Gable to close.
Thank you, Mr. Speaker. So this bill before us today simply clarifies the well-established legislative intent of the Healthcare Right of Conscience Act. That is all. It is not a mandate. We are not mandating anything. We are not requiring anyone to do anything new. As the bill itself says, it's merely a declaration of existing law and not a new enactment. It remains the case that the bill enshrines all federal protections available to anyone, including any civil rights or religious protections. It's very narrow, related to COVID-19, and I urge an aye vote.
Members, Representative Ugasti has requested a verification. Please vote your own switches and remain in your seats. The question is, shall Senate Bill 1169 pass? All those in favor vote aye, all opposed nay. The voting is open. Mr. Clerk.
Representative Halberg.
No.
Representative Halberg votes no. Representative Morrison.
No.
Representative Morrison votes no. Representative Tarver.
Yes.
Representative Tarver votes yes.
Have all voted who wish? Have all voted who wish? Have all voted who wish? Mr. Clerk, please take the record. On this question, Mr. Clerk, Mr. Agasti has asked for a verification. Please read the names of those voting in the affirmative.
A poll of those voting in the affirmative. Representative Andrade, Representative Avalar, Representative Buckner, Representative Carroll, Representative Cassidy, Representative Collins, Representative Conroy, Representative Costa Howard, Representative Crespo, Representative Croak, Representative Davis, Representative Delgado, Representative Didich, Representative Evans, Representative Ford, Representative Gable, Representative Gon Gershowitz, Representative Gonzalez, Representative Gordon Booth, Representative Greenwood, Representative Gazzardi, Representative Halpin, Representative Harper, Representative Harris, Representative Barbara Hernandez, Representative Lisa Hernandez, Representative Hirschauer, Representative Hoffman, Representative Jones, Representative LaPointe, Representative Lilly, Representative Ma, Representative Manley, Representative Mason, Representative Myers-Martin, Representative Moeller, Representative Morgan, Representative Moylan, Representative Mussman, Representative Ness, Representative Nichols, Representative Ortiz, Representative Ramirez, Representative Rita, Representative Robinson, Representative Scherer, Representative Slaughter, Representative Smith, Representative Stava Murray, Representative Stoneback, Representative Stewart, Representative Tarver, Representative Vella, Representative Walker, Representative Walsh, Representative West, Representative Ann Williams, Representative Jawaharlal Williams, Representative Willis, Representative Yang Roar, Representative Yednock, Representative Yingling, Representative Zaleski, and Mr. Speaker.
Representative Ugasti.
Gon Gershowitz? Oh, there she is. Okay. And is Representative Ness present? There she is. Okay. All right, withdrawn.
Representative Ugasti has withdrawn his verification. On this question, there are 64 voting yes, 52 voting no, 2 voting present, and this bill, having received a constitutional majority, is hereby declared passed.